Welcome. I'm Terry Tropin, and today I'll be discussing the 2023 update for CPT sections in the next few weeks. Let me start with some information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus, and I have RHIA and CCSP certifications. I'm also an AHIMA-approved ICD-10 trainer. I taught health information technology at Montgomery College for over 20 years. I've also written books on coding. So here are my books. Let me get my pencil here. There we go. Here are my books. These are all available on Amazon, and each of these has already been updated to 2023. So you can get the 2022 versions if that's what you need right now, but you can also get the 2023 versions. Okay, so this is an overview of what I'm going to talk about during this presentation. So there are new codes for implantation of absorbable mesh or other prosthesis, and also new and revised codes for removal of sutures and our staples. So not a lot of changes, but the changes are important. So let's look first at implantation of mesh. This new code is 15778, implantation of absorbable mesh or other prosthesis for delayed closure of defects, i.e. external genitalia, perineum, abdominal wall, due to soft tissue infection or trauma. Now there's a lot in here. This is a very, very specific code. The mesh is absorbable. It's delayed closure of defect, so not immediate when they treat the wound or infection. It's not closed immediately, it's delayed so they can drain and so they can observe the infection to make sure that it's getting better. So absorbable, delayed closure, it's for soft tissue, and they say i.e. external genitalia, perineum, abdominal wall. And it's to treat an infection or a trauma. So these are so it has a diagnosis code in this procedure code. Okay, so first of all, what is surgical mesh? Well, you know what surgical mesh is. It's used to reinforce tissue or bone. The most common reason is for a hernia, tissue's moved out of place, and you put in mesh to reinforce it, to keep the tissue where it's supposed to be. So it can be synthetic, it can be biologic, meaning from animal tissue, or it can be a combination of synthetic and biologic. Okay, it also specifies that the trauma or infection affects soft tissue. So what's soft tissue? Nerve, muscle, connective tissue, lymph nodes, blood vessels, and fat. So this, as I said, these codes are very, very specific. Absorbable, trauma or infection, and for soft tissue. Okay, so it's also just as important as what is included is what is not included. Codes under this new code indicate it's not used for repair of anal rectal fistula with plug, anterior abdominal or peristomal hernia, repair of pelvic floor, or facial reinforcement of abdominal wall. And so it lists these, do not code use for these conditions, and it gives you the code to use instead. So that's what you can't use it. What are you going to use the code for? Well, it might be used for treatment of Fournier's gangrene, which is necrotizing fasciitis of the genitals. I was going to put a picture of this up there, but you don't want to see it. Soft tissue infections of the scrotum and perineal tissues that often require debridement and delayed closure, and infections following initial treatment of a condition. So secondary closures, secondary treatment of a condition, and then you want to let it keep it open and drained. Okay, so that's absorbable mesh. So there's also change in the integumentary system is removal of sutures and staples. So code 15851 has been revised. So you can see what's the words that underlined are new, and the crossed out word, the deleted wording is crossed out. So now it reads removal of sutures or staples requiring anesthesia, i.e. general anesthesia or moderate sedation. Now, moderate sedation is the patient is sedated but will not feel pain, but awake enough to respond to questions or touch. So do not use this code for suture and or staple removal to reopen a wound prior to performing another procedure. So this is the end point, the end of the treatment, removal of the sutures or staples, not opening up a wound in order to do something else, do another procedure. Okay, so here is a new code. Note first that 15851, the revised code, is not an add-on code, but the new code, 15853, is an add-on code. That's important. It's used for removal of either sutures or staples without anesthesia. So, sutures or staples, not requiring anesthesia. Now, and it's an add-on code. So underneath this code is a note about when this code is used. What can it be added on to? This is E&M codes for new and established patients, outpatients, this emergency department codes, and home or residence codes. And it also says do not reuse 15853 with 15854. So let's talk about what 15854 is. 15854 is sutures and staples. Remember the previous one was sutures or, and no anesthesia. And again, it has the same list of codes, the outpatient, new and established codes, the emergency room, home or residence codes. There's also a note that says don't use 15854 with 15853. So it's either sutures or staples or sutures and staples, one or the other. So let's compare these, the revised code and the new code. So the revised code is not an add-on code. It says sutures or staples and requires anesthesia or conscious sedation. 15853 is sutures or staples, just like 51, except no general anesthesia is used. 15854, sutures and staples, no general anesthesia. So these are related but can be confusing. So it's either sutures or staples or sutures and staples, and then depending on whether or not there's anesthesia. So that completes this video. If you have questions or comments, please feel free to contact me. If you'd like to purchase a copy of the slides, give me a thanks, $5 or more underneath the video, and comment with your email. Give me your email address so I can send the slides to you, and I will send a PDF. If you enjoyed this video, please give it a like and subscribe by clicking on the picture in the lower right-hand corner. And remember, there'll be more videos up about the 2023 changes. And again, here are the books I have written. These are all available on Amazon. And there's the link to it. The link is also in the description. Thank you so much for listening.